Ah, how are students? Yes. So, if you find this page to be variable, invite your friends because we are going to be discussing educational series of mental health. Um, so what happens that a lot of people in different schools they don't learn about the psychotropic medications and they find it very, very difficult to answer the questions when the questions are involving medications. So today we are going to look at the treatment methods in psychiatry. When a patient comes to the hospital, they can be given medication, they can also be talked to, and in a situation where medications do not work, the patient must be sent to electroconvulsive therapy, whereby we introduce electrical current in the head to induce a seizure-like, and that one has proven to treat mental disorder. So there are three main methods of treatment in psychiatry. Today, we are going to talk about the use of medication in psychiatry. So, all those medications which are used in psychiatry, they are called the psychotropics medications in general. Because in the exams, you'll be asked to say, what do you call the groups of the drugs which are used to treat mental disorders? In general, they are called psychotropics. And then under psychotropics, that's when we have antipsychotics, that's when we have antidepressants, that's when we have antimanic. Sometimes these can also be referred as mood stabilizers. Then we also have got anxiolytics medications. Then also they are also known as benzodiazepines, and you can also refer them as the hypnotics. Then the last one, they are called the anticholinergics or antiparkinsonisms. So people, it's not boasting. These are lifetime lectures. Understand? Huh? Yes. So now, today, I'm going to dwell my mind on antipsychotics medications. So before that, let me give you the brief history of these medications. Before 1950s, there were no antipsychotics medications on the market, and these drugs were discovered accidentally. There was a surgeon who was taking the patients for operations. As you may aware, when the patient is being taken for the operations, they become so anxious, so worried. So this doctor was just trying to relieve anxiety, but in the process, he discovered that these drugs they had a calming effect. So these drugs were discovered on the basis of providing calming effect, because, or calming if you want, because a lot of these patients psychiatry they agitated. So the psychotropics medications, the first psychotropics medications were discovered in 1950s. These antipsychotics medications, first of all, we must define them. What are they? Against psychosis. So these medications are against psychosis. You understand? Come on, guys. So we are saying these medications are medications which are used to treat psychotic disorders such as schizophrenia, brief psychosis, schizophreniform, drug-induced psychosis, HIV-induced psychosis, delusional disorder. Why these conditions are regarded as psychotic disorders? Because the many prominence of these conditions, it is the delusions and hallucinations. And most of the times, when the patient is experiencing delusions and hallucinations, they lose in touch with reality. Understand? Yeah? Yes. So these antipsychotic medications are divided into two. As the typical antipsychotics as well as the atypical antipsychotics. The typical antipsychotics are also referred as the first generation or the old generation, and the atypical antipsychotics are also referred as the second generation and the new generation. So now, when we are treating these psychotic disorders, come on guys, please, these videos are not made for clinical area. These videos are made for education purpose. When these medications are treating psychotic disorders, there is no single antipsychotics medications which is specific for a particular patient. Usually, when you are choosing these antipsychotics, treatment is by trying and error method. So there is no specific antipsychotic for a specific condition. We have to bear that one. So today, let's talk about the typical antipsychotics. The typical antipsychotics. So later on, I'll also discuss the atypical antipsychotics. Student, please, this is your opportunity. When Miss International is on the screen. Just like that. Yes. Firstly, I rehydrate. Coca-Cola company, I'm promoting your products, so pay me money. Now, yes. So, let's talk about the typical antipsychotics. So, these typical antipsychotics, these were the first psychotropic medications to be discovered in 1950s. Student, you must mark the year 1950s because the NMCZ is going to ask you to say the first generation antipsychotics were discovered in which year? 1950s. So let me give you examples of the drugs which fall under typical antipsychotics. We have Lagactil, also known as the chlorpromazine. It is also known as the thorazine. So you must master all these names. So this Lagactil comes into sometimes 25 milligrams, sometimes 50 milligrams, sometimes 100, sometimes 200 milligrams, depending on the supply from medical stores. So this Lagactil or chlorpromazine, it is a low potent antipsychotic, and it is in very rare situations that it can cause the extrapyramidal symptoms. Another example of the drugs which fall under typical antipsychotics, we have haloperidol, also known as Hado, also known as Serenas. It comes in form of tablet form, 5 milligrams per tablet, injectable forms, 5 milligrams per meal, and also in syrup form. Yes, so haloperidol, it is also known as Hado, haloperidol, or Serenas. This one is a high potent antipsychotic. That's why it should never be given in higher doses. That is according to World Health Organization, because this drug can induce movement disorders, aka extrapyramidal symptoms, and we're going to look at them when we'll be talking about the side effects of antipsychotic medications. Another one, we have Modicate. This one is given in form of depot injection. So the other name for Modicate is fluphenazine. Usually, it is given for maintenance and also for those patients who have got difficulties in terms of tolerating oral medications. The other one, we have sterazine or trifluoperazine. This one comes in form of tablet forms only. It comes into 5 milligrams per tablet. Then the last one, we have thioridazine. This one comes into 25 milligrams per tablet.